An ACL injury is really a tear or rupture of the anterior cruciate ligament, and the ACL is the main stabilising ligament in the knee. ACL injuries are one of the common knee ligament injuries seen by orthopaedic surgeons. There is an increasing number of people who experience this injury, and that's due to a number of reasons, such as increasing number of people playing sports. Our sports participation rate is starting at a younger age, and we're playing sports all year round. No longer are we involved in summer or winter sports only. And following improving diagnostic skills over recent years, we are picking up these injuries sooner. Usually the patient will experience a popping sensation at the time of the injury and will collapse or fall to the ground. Often they'll say that other players may have heard the pop as well. They're usually not able to continue playing and their knee will swell fairly quickly. In the immediate period after the injury, general principles of RICE should be followed, and this is rest, ice, compression and elevation. Surgical treatment for an ACL injury is reconstruction of the torn ligament, and this is because the ACL has a poor capacity to heal. Education in areas such as warming up before sports, learning how to land correctly from jumps and improving proprioception, which is the patient having an awareness of their knee joint position under different activities and loads, have been shown to reduce the risk of repeat ACL injuries. For patients who undergo an ACL reconstruction, it is imperative that they participate in a comprehensive rehab physio program. As a general rule, it will take about 12 months before the knee is fully ready to return to unrestricted activities, including sports.